Hello, everyone. I got an interesting report coming out of the mainstream this morning, and I'm kind of quite pleased to start seeing these articles come out of the mainstream. I will put a link in the description of the video so that you can read the article at your leisure. It is a little bit of a lengthy article, so what I'm going to do is I'm going to put out, before I even start reading the article, I'm going to put out the most important part of this entire video, of this article, of anything you could glean from this. And that is, if you are somebody out there, for whatever your convictions, that you don't feel that it is in your best interest to be forced to do something in order to keep your position of employment, I want you to understand two things. Number one, you're not alone. You're not alone. No matter how alone they make you feel, you're not alone. I think numbers around this entire thing are being exaggerated. I think they're being misrepresented. I think they're just being flat out lied about. And I really honestly believe that you have a lot more support than you'll ever know. So number one, don't think you're alone. Don't think you're alone. And number two, stand firm. Stand firm. So with that being said, let me go ahead and jump into the article that I am referring to. It's out of KMOV, which is a local news station here. I think CNN actually did the article, but it's titled Missouri Hospital CEO Worried Staff Will Quit Over COVID-19 Vaccine Mandate. Pretty upfront, right? Dr. Randy Tobler, CEO of Scotland County Hospital in Memphis, Missouri, has struggled to retain staff during the COVID-19 pandemic, losing 10 of his 57 nurses in the main hospital and 3 rural health clinics. So Tobler can't afford to alienate any more healthcare workers, but he believes a COVID-19 vaccine mandate could do just that. Such a requirement won't make his unvaccinated staff get the shot, he says. It will make them quit. Our reality is we need staff to work, and in return for your working, we're not going to ask you to get a vaccine mandate, he told CNN. There were people in the hospital that freely shared that if the vaccine mandate happened on our account or on anyone else's, they would not work here. That's just something they weren't going to put in their body. That's why Tobler disagrees with the vaccine mandate announced by President Joe Biden last month that will apply to millions of healthcare workers across the country. These are arguably the most crucial group of workers to have inoculated because the vaccines would protect them and their patients and keep the staff healthy so they can continue working. That's why they were among the first to be offered a COVID-19 vaccine. Pardon me. There are indications that vaccine compliance is high among healthcare workers. Many professional healthcare associations have surveyed their members, the majority of whom said they are already vaccinated. But despite evidence vaccines are safe and effective, some healthcare workers have resisted. At Scotland County Hospital in rural northeastern Missouri, the difference is stark. Just 60% of the staff is vaccinated, according to the hospital. Among those who are not is Sheila Bouch, if I said her name correctly, who works the hospital's front desk and is often the first person to see when they arrive. People see when they arrive. So far, she has decided not to get a COVID-19 vaccine, but that's not because she doesn't think the virus is a threat, she told CNN. I do believe COVID is terrible. I believe it's dangerous, she said. I watch people every day, and I watch the fear in people's eyes every day. But I do not think the government has the right to step in and mandate and tell us what we have to do. This is what she had said. YouTube. Asked what she would do if Scotland County Hospital mandated that she get vaccinated, Bouch said she'd look for another job. She doesn't want to, she added. She cares for her patients and the people she works with. But at the same time, I'm not going to personally go against something that I feel very, very deeply in my soul would hurt me, she said. This is her words. the vaccine mandate, and this is whatever you want to call it there, it says mandate is going to backfire. The vaccine mandate announced last month could apply to as many as 100 million Americans, including the 17 million healthcare workers at facilities that receive funds from Medicare and Medicaid, like hospitals, home care facilities, and dialysis centers. The Centers for Medicare and Medicaid Services is still working to develop the rule for the mandate, and it won't likely be issued until sometime later this month. But CMS is urging healthcare workers in these facilities to begin getting vaccinated immediately. I criticized President Biden's mandate, Tobler said. I thought it was a mistake because I think it's going to backfire. After losing nearly 18% of his nurses during the pandemic, Tobler believes that not requiring the employees to be vaccinated helped prevent the hospital from losing more workers. A lot of people were pleased that we honored their right to choose what they want to do with their body, he said, and I think that they may have helped retain some staff that may have been tempted to jump to other places because of salary or what they perceive as different working conditions. Still, Tobler can't make sense of why so many won't get vaccinated. For people who have rejected inoculation or remain on the fence, he says watching a loved one or someone they know get seriously ill or die is often the catalyst that changes their mind. But even that won't convince these healthcare workers who have spent months watching and caring for COVID-19 patients. It's inexplicable, Tobler said. Balch couldn't be convinced by her own doctor, Shane Wilson, who also works at Scotland County Hospital. He talked with staff members who don't want the vaccine, and most of them remain skeptical over what they consider to be unknowns, like whether they will have health problems in the future as a result. Health experts have said any adverse side effects from vaccine usually show up within at least the first 2 months. It's incredibly frustrating to try to get the understanding across that you're not just protecting yourself. We're doing this to try to keep our neighbors healthy, Wilson said. We're doing this to try to keep others from losing people. Another little subheadline or whatever, we're going to be short of nurses, it says. Tobler feels his approach is simply a reflection of the community where he and his staff live and work. Just 20% of the population of Scotland County has been fully vaccinated, according to the data from the U.S. Centers for Disease Control and Prevention. Kurt and Jamie Triplett, two brothers who co-own a farm in the area, aren't among them. Kurt Triplett told CNN he has a problem with the vaccine, but he thinks it's been turned into a political football that has turned off some rural Americans. Jamie, meantime, said he's not vaccinated because I just feel like my risk of being exposed to COVID and what it would do to me is not greater than the risks of the vaccine. Over breakfast at Lacey's family dinner, Ricky Fowler and Stan Barker told CNN they both have gotten vaccinated. Fowler got his vaccine right off the bat as soon as I could, he said, and Barker said he feels more secure after getting the shot that I won't get COVID-19. But a third man at their table, Alan, who declined to give his last name, isn't convinced. He has not gotten a COVID-19 vaccine, and he doesn't believe they've been proven to be safe, even after the vaccine by Pfizer and BioNTech received full approval by the U.S. Food and Drug Administration. Alan's daughter, a nurse at Scotland County Hospital, also hasn't been vaccinated, he says, despite working and caring for COVID-19 patients through the pandemic. A mandate, he said, would violate my constitutional right, and where Shelby works, my daughter, she'll just quit. So will like 3 or 4 others. So if they mandate it, he said, we're going to be short a lot of nurses. Back at Scotland County Hospital, Balch echoed that, saying a mandate would hurt healthcare workers and the care they provide. If you lose your healthcare workers, she asked, then who's going to take care of the people that do have this disease? He asks a very valid question. So the mainstream's starting to actually come around, you know? It's kind of hard to continually ignore what's really going on when you have full stadiums of people screaming, "Let's go, Brandon." Right? This is insane. This is insane. You know, I do think that if we can have an effect on anything, it may not be governmental policy, but we might be able to have some of an effect on the media. If we can make the media look extremely bad, which is exactly what this whole Let's Go Brandon thing did, then they will have to choose to either continue to humiliate themselves, which is going to hurt their bottom dollar. That's going to take directly from them. Or they're going to have to start talking about what it is you really want to hear. So I think if there's anything that we can affect in all of this, that would be it. Do I think that we're going to win this battle in the end? Well, you know what? I don't question the Father. And the Father says we're not. We're not. We got a long way to go. We got a far way to go down. But we're supposed to stand on our feet and fight the entire time, no matter what. We are supposed to stand firm. Shalom.